Good morning, Amanda here, studying for pediatrics examination. Neuro is what I'm covering right now, and in this video, I think I'm going to focus on cerebral palsy. So let's get into cerebral palsy. It's a non-progressive neuromuscular disorder of varying degrees resulting from damage or defect in the part of the brain that controls motor function. Right, so it's very important. Cerebral palsy has to do with a lot of loss in motor function. And they're a group of disorders arising from a malfunction of motor centers and neural pathways in the brain. The types of cerebral palsy, you have ataxic, athetoid, spastic, rigid, and mixed. And the causes for cerebral palsy are mostly unknown. Anoxia before, during, or after birth, infection, and trauma are also other potential causes of cerebral palsy. There are no characteristic pathological picture of cerebral palsy. It's basically a previous anoxic episode that plays the largest role in the pathological state of brain damage. The complications of cerebral palsy have impaired physical mobility, self-care deficits, physical injury, impaired communication, and mental impairment. Now, with all types of cerebral palsy, you have delayed gross motor development. Abnormal motor function and coordination can manifest early in life, such as poor sucking, feeding difficulty, all of that might, it's a red flag. Postural abnormality occurring at rest or when changing position, altered muscle tone such as increased or decreased resistance to passive range of motion, opistotonic postures such as an exaggerated arching of the back type of thing, spasticity of the hip muscles and lower extremities making diapering very difficult. You also might notice abnormal reflexes and persistent primitive reflexes. For instance, neonates tend to have reflex such as Moro reflex, tonic neck reflex, and Babinski reflex, and things like that. If you have a persistent of those primitive reflexes, then you know that that is requires more assessment or further assessment. You also might find that children with cerebral palsy might have mental retardation of varying degrees in 18% to 50% of patients, really. Most children with cerebral palsy have at least a normal IQ, but they can't demonstrate it really on standardized tests. They also might have seizures. They also might be plagued with attention deficit hyperactivity disorder, sensory deficits such as vision, hearing, and speech. Now, if we go into the specific types, the ataxic cerebral palsy, you'll have poor balance and muscle coordination caused by disturbances in movement and balance. So you have unsteady, wide gait. The athetoid cerebral palsy is involuntary, uncoordinated motion with varying degrees of muscle tension. You have slow state of writhing muscle contractions whenever voluntary movement is attempted. You have facial grimacing, poor swallowing, drooling, and poor speech articulation. With rigid, you'll have just a rigid posture, lack of active movement. Spastic, you have hyperactive stretch reflex and deep tendon reflexes. So you have rapid involuntary muscle contraction and relaxation, and contractures of extensor muscle. You'll also notice scissoring. With mixed cerebral palsy, there's just signs of more than one type, and this is just severely disabling. Diagnostic test findings, you would find neuroimaging studies to determine the site of the brain impairment. Cytogenic studies, basically genetic evaluation to determine if it's something that the child's acquired genetically. Metabolic studies also to rule out other causes as well. Medical management might include baclofen pump insertion, which delivers baclofen, which is a skeletal muscle relaxant, and it delivers it directly into the intrathecal space around the spinal cord. And it's used to treat spasticity or muscle spasms. The pump lasts for 3 to 5 years, and after that time, a new pump must be in place. It must be implanted back and must be replaced. Muscle relaxants or neurosurgery to decrease spasticity, if appropriate, is also another medical management. Anticonvulsants such as phenytoin, Dilantin, phenobarbital to control the seizures. You also might have orthopedic surgery, maybe indicated to correct any kind of contractures that might have happened. Braces or splints and special appliances such as adapted eating utensils and low toilet seats with arms to help the child just perform activities of daily living independently. Our nursing interventions with cerebral palsy, you want to institute a high-calorie diet for the child with increased motor functioning, just to help keep up with the increased metabolic demands. You want to perform range of motion exercises to minimize contractures, assist with locomotion, communication, and educational opportunities, just enable the child to attain an optimal developmental level. Make food easy to manage just to decrease the stress during meal times for the child. So finger foods, anything that's easier for him or her. Promote age-appropriate mental activities and incentives for motor development to promote growth and development. Provide rest periods and promote rest to reduce metabolic needs. Big one is always safety. Provide a safe environment. For example, head equipment, bed pads if the child has seizures. You want to divide the task into small steps to promote self-care and activity and increase self-esteem. And if the child can't speak, you want to use assistive communication devices to promote positive self-concept for that child. And also important to assist the family members in setting realistic goals and for that child, and managing stress, because it could be a very stressful thing having a child with a disability such as cerebral palsy. And that's it for now. We just ran through cerebral palsy, and the next video I think I'm gonna go back over intracranial pressure and head injury. Bye.